Assalamu alaikum. My name is Zubair Khanzada. I'm one of consultant surgeons from Peshawar, Pakistan. We are starting this very exciting LAPcast, which is a series on the leaders in surgery in this region in the world, the pioneers of surgical specialty in Pakistan. We're starting with general surgery today, and one of the most renowned name in general surgery for Pakistan is Professor Majeed Chaudhry. I'm really blessed today and honored with his presence. Assalamu alaikum, sir. Sir, first of all, I would really thank you that you've taken the time out and you visited us in Peshawar today.
My pleasure.
And given us time.
My pleasure.
Sir, I would request you, first of all, to start with, if you can do a brief introduction about your current position and where you're working for the audience, and then we will take it from there, sir.
These days, after serving the government of Punjab and the health department for like 32 years, these days I'm looking after the newly built cancer care hospital in city of Lahore. It's basically a huge philanthropic facility for the poor people. Not only me, but two of my sons and two of my daughter-in-laws, 5 of us are doing free surgeries in cancer care hospital. And, I think this is something which we owe to the people of Pakistan and to this nation.
That's simply amazing, and when I heard about it the other day, I was personally so impressed, as unfortunately in this part of the world, a lot of people, majority of the patients are less privileged, and cancer treatment, as all we know, it's very expensive. And doing such a job with dedication, not yourself, but the whole family getting involved.
Alhamdulillah.
That's such an amazing initiative. May Allah subhanahu wa ta'ala reward you, sir. This is such. I was totally so much impressed the other day. But sir, could you please tell me about your journey? And I may request maybe you can start from because for many people in the audience like myself, they really take aspirations and inspirations for people like yourself. So would it be possible, may I request to tell me about your journey? You may start from the...
Sir, I started, my graduation was in 1973 and served for a little while in Pakistan, and then went to England and, worked in most of the time in teaching hospitals in London, like Edinburgh Royal Infirmary, Bristol Royal Infirmary, Queen Mary's London, St. Thomas's Hospital. And in 1979 decided to come back to Pakistan to serve my country. And I was appointed as assistant professor of surgery in King Edward. And 2 years later I was promoted as associate professor, and worked there for quite some time till I became a professor in 1993, and served in Lahore General Hospital for a year and Allama Iqbal Medical College, and finally came back to King Edward Medical College and served there as chairman Department of Surgery for a good around 12 years, which is probably the longest tenure in the history of King Edward Medical College, Mayo Hospital. I was very lucky to have this, and then was posted as principal of Fatima Jinnah Medical College, where I retired, and then I worked as principal for about 13 years in private sector in Lahore Medical and Dental College, and these days I'm looking after Cancer Care Hospital.
That's so amazing, sir. That's so impressive. And also, just to add on, quite a lot of leading surgeons in Pakistan are actually trained by Professor Majeed Chaudhry, and it's such an honor to have him.
While sitting in Peshawar, let me add another thing.
Yes,
I was, my mentor in the surgical field was Professor Sayyid Ali Raza Gardesi, who served in Peshawar for many years. Before going back to Lahore, and whatever I am today is all because of my teachers.
Amazing, sir. That's really about being amazing, sir. I'm totally impressed, sir. I would like to, if you could, because sir, you have been there for such a long time, and I was totally amazed by your journey. What are your thoughts on, or in fact, I would like to ask your experience, and as if you can narrate it as a story of laparoscopic surgery or minimal invasive surgery in Pakistan.
Well, I tell you, in 1992, I was in Mayo Hospital as an associate professor, and one of these doctors came from Sweden in Lahore, and we started working together, and we developed this facility in 1992 in Mayo Hospital. And in those days it was so difficult to get the equipment even, but we managed it sometimes from our own pockets. And then I went to Lahore General Hospital, which is now Amiruddin Medical College, after the great Professor Amiruddin. And there, in the government of Punjab, probably in Pakistan, the first laparoscope was bought. And I think from then on, we started learning ourselves, traveled the world, trained people, and in laparoscopic surgery. And I think, it's very satisfying that most of the senior surgeons now have been part of our teams at Mayo Hospital. And it's very satisfying. But I think at the same time it's a responsibility to the profession, to the nation, and to our beloved country. And I have been advisor of the Royal College of Surgeons and Physicians of Glasgow, and for the last 22 years. And nothing would happen in this region without my recommendation, which was an honor not for me, but for my country. And I was recently invited in Glasgow. They chose 3 people to award special fellowships in the world, and I was luckily one of them.
Amazing.
And so this was an honor for my country.
Amazing, sir. That's right. And I also understand, sir, you started the first Pakistan Surgical Society. Is that?
Not me. It was Professor Kabir Sahab from Peshawar who started it, and then he persuaded us, and we started soon afterwards in Lahore, Karachi, and we had 13 chapters all over the country of Society of Surgeons. And that was way back in 1981-82.
Okay, that's amazing.
Yeah.
And I also understand, sir, that you were involved in the SARC Surgical Society.
I was president of the SARC Surgical Care Society, and we did a lot of conferences in Pakistan, in SARC region, and started training of surgeons from various countries, wherever who could travel. And I think that's it's still going on and around the world. But although its now name has been changed from SARC to South Asian Surgical Society because of some political motives, but